Good morning, my name is Chris Arrowsmith. I'm one of the critical care doctors with Great Western Air Ambulance. Now you may have seen our helicopter, the GWAAC helicopter, land on this heli deck recently on TV. Now we've taken advantage of this beautiful weather here to demonstrate to you exactly what would happen if the helicopter was to land here and then walk you down the steps, the lifts to get to the A&E below. Of the 2,000 or so patients that GWAAC saw last year, they conveyed by helicopter 42. Of those 42, 10 of them came to this heli deck here and were delivered to either the Heart Institute, so the A&E below us, or the Children's Trauma Centre just next door. When you're on scene with your patient, you think about a couple of things. You think about how far the hospitals are and how quickly you could get there by roads versus air, and then how long it might take to unload a patient on a helipad and go down all the lifts, etc. So here in the BRI, for example, it's 10 minutes from shutting the engines down to getting into the A&E, so you've got to add that onto your journey time. Whereas for an ambulance, it's probably about 2 or 3 minutes. If something goes wrong in transit, it's much easier to pull an ambulance over and do something to help your patient than it is to do it in the back of a helicopter. The flip side is helicopters are a lot faster and can go, over all the traffic. So you kind of balance all those things up to work out where you're going. So University Hospitals, Bristol and Weston includes the Children's Centre there, and that's a major trauma centre for kids. So if it's a person under the age of 16 and they have had traumatic injuries, then you bring them here and take them to the Children's Hospital. And then the main one is we have a specialist cardiac centre, the BHI, the Bristol Heart Institute. So out of hospital cardiac arrests are all brought here for specialist care. So we split that into the things we do to prepare our patient and then the things we do to prepare the heli deck, if you like. The heli deck isn't always open and the lights aren't always on, so we need to call ahead and let them know that we're coming in. The patient, so it depends if they're awake or asleep. If they're asleep, they're popped in the back as stable as possible with as much access as possible in the back of a helicopter and flown here. If they're awake, then they can either have some earplugs or some ear defenders, possibly a big headset, so we can talk to them in flight and let them know what's going on. They'll be kind of tied down on their back, and it's quite scary to be in a helicopter tied down on your back if you're not being spoken to and you don't know what's going on. So the pilot has responsibility for the journey and then for the landing, and then overall responsibility to make sure that the heli deck is clear and ready and open to us. So they'll double check that, they'll call ahead, let them know that we're coming in, that sort of thing. The pilot also has responsibility for the safety of the crew in the back of the aircraft, so they'll check that everyone's appropriately has their seatbelts on, everyone is secure, safe. So the seat next to the pilot's technical crew member, now they normally face forward and assist the pilot with flying, looking out for things, checking the monitors. Now when there's a patient on board, that chair rotates 180 degrees to face the patient. So you've got that chair facing the patient's here, and then you've got 2 other chairs which normally have a doctor and paramedic in them next to the patient that are helping with the general care. If there is an awake child that you have to fly, then you would consider bringing a parent along so the child isn't alone. That's pretty rare because normally if a child is awake, you put them in an ambulance, not a helicopter. And then there's a space issue where we've only got 3 chairs in there for clinical staff, so we might need all these clinical staff to help look after the patient. So theoretically, yes, but it is very rare.